Thank you, Chairman. Thank you, ladies over here. I'm short. Okay. Thank you for all that you're doing. And probably would just request Mary Franklin come up here to have a question on Act 974 that this body passed in 2019 for some work requirements for SNAP recipients. And we graciously gave you guys some time because we're doing a complete overhaul in Axios there. And so can you guys give us an update on where we are right now with that? Thank you.
Glad to give an update. I'm going to defer to Director Franklin to go ahead and start us off.
Good morning, Mary Franklin, Director of Division of County Operations at DHS. So we have not yet implemented a mandatory SNAP employment training per Act 974, but I want to make clear that the work requirement for the able-bodied adults without dependents has resumed. It resumed as of June of 23. And so we do continue to close cases for those able-bodied adults without dependents who do not meet requirements and or meet an exemption. We also do continue to still offer and provide services to those who volunteer for employment and training. And if those able-bodied adults do not take advantage of employment and training or other things like work or volunteering, they do lose their coverage after 3 months, and they do in a 36-month period.
Just a quick follow-up, Chairman, if that's okay. So, yeah, thank you. So, ladies, thank you. So, just to re-clarify for us, so even though we've not put the mandatory policy in place, actually the federal requirements are actually doing exactly what we were, the intent of what we had in Act 974. Can we say that?
That's correct.
Okay.
Yes, ma'am.
All right. Thank you all very much for your time. I appreciate it.
Representative Beaty, you recognize.
Thank you, Mr. Chair. Going back to Representative Bentley's questioning on 974 and the rule implementation, can you explain why, since 2019, we haven't implemented that rule?
Yes, sir, I will start, and then I will ask Director Franklin, and of course some of that time predates my time here in Arkansas. But I would like to flag that 2019, we then went into 2020, which of course, you know, many of the federal requirements were paused during the pandemic, during the public health emergency. Director Franklin indicated that we did resume the general work requirements for SNAP in June of 2023. SNAP has, they have work requirements in place. They are required of all able-bodied adults without children. The employment and training program is a separate piece of that. It's a mechanism through which people can access employment and training services. We do have providers throughout the state who provide these services, and I will defer to Director Franklin to give some details on those providers and where we currently are, but we had not completed implementing the mandatory portion of it because that is a requirement on the state to build out those services and require participation. Instead of individuals accessing employment and training on their own, it requires participation through the state program.
So we do have several providers. Career education through Department of Commerce is one that is statewide. They do provide services statewide. We have a couple of other, we have Our House that also does employment and training in Pulaski County. Arkansas Employment Career Center does provide services here in Pulaski and in Jefferson County. Northeast Arkansas Community College is one of the providers. This is from the top of my head. So we have another one, Allied Health in Garland County, that is a provider. So even we do have some coverage, like double coverage, since career education does provide statewide coverage, but we do not have the capacity that would be needed, even though we have statewide coverage, to manage the number of individuals that would be required based on Act 974. So that is something that would have to continue to be built out. And Other explanation for why it has not been implemented yet, I mean, as you're aware, we had the pandemic and we weren't able to make progress on that during the pandemic. Most of the work requirements were federally suspended during that time. And then since then, with unwinding the pandemic and other things that we have been dealing with, we just have not been able to fully implement or get to the point where we're able to do mandatory employment and training.
Senator Gilmore, you recognize.
Thank you, Mr. Chair. So just circling back to Act 974, just so I understand. We passed a law, the legislature did, and then we didn't implement the law. I know there was if I remember correctly, I think there was 2 years given to implement that, but we didn't implement it because the federal requirements already allowed for work requirements, or what was the reason?
The federal requirements do allow for work, but that
Okay.
was not the specific reason. Initially, we were in the middle of the pandemic, so all federal work requirements and other requirements were paused.
Okay.
Those did not resume until the end of the public health emergency, and that actually resumed in June of 2023. So it's actually been about a year and a half. We have been working with providers to expand our provider network for SNAP employment and training. We have not implemented the full mandatory aspect of the program, and we would actually welcome some further discussion with interested members on that and the approach to that. What we would like to avoid is creating additional programs where there's not a need, and we want to seek input on that.
Okay. Fair. We don't want to create any more programs without a need. What effort was made at granted you weren't here at the time, what effort's been made, though, to have a conversation about this particular act that the legislature passed and why it can't be implemented? Or, because I think what concerns me is if we pass laws of this legislature and for whatever reason it's burdensome or costly or whatever it is, the agency just decides not to implement it. I mean, I think we need to have a conversation about that. Wouldn't you agree?
I completely agree with you, and it is at this point that I'm pursuing that conversation. It was not something that was raised during my first year here. We have recently discussed it as far as the upcoming session, and we would like to discuss, what the details of a mandatory SNAP ENT program actually place on the state versus individual responsibility. Because to your point, we're not in the business of growing government programs, but we are in the business of growing individual empowerment and self-sufficiency.
Couldn't agree with the statement anymore. I would just like to add, so you're coming and asking for a repeal of that law in the session?
That is something that I would like to discuss.
Okay. Thank you, Mr. Chair.
Senator Representative Beaty.
Thank you, Mr. Chair. I had a follow-up back on 974. When I had staff reach out to the agency about outstanding rules, Act 974 was not on that list. Has it now made it to that level that this is something that you will actively be working on to procure a rule, or as Senator Gilmore asked, move forward in the coming session to repeal Act 974?
We would like to have the discussion about whether we should pursue those rules, and we would respectfully request to have that with the legislature.
Thank you.
Yes, sir.